Hello, once again welcome to scanO Café. I'm your host Dr. Vidhi, co-founder of scanO, and today I'm thrilled to have a very special guest with us. Welcome to our show, Dr. Selvaraj.
Thank you so much for inviting me to your show.
He is not just the pioneer of inculcating digital dentistry in a remote island in Andamans, but also the very first one to inculcate AI in dentistry. Doctor, tell us about how was your journey growing up when you started your clinic 14 years back to the changes that we see these days among patients and the overall practice of dentistry.
Actually when I came 14 years ago after doing my post-graduation from Georgia, the dentistry here was very basic. Dentists used to call specialists from outside for simple procedures like root canal treatment and orthodontics and implants. So when I came back, I did not get a very good motivation to start a clinic. But then, I wanted to do something different for these islands because I'm a son of the soil. So I want to give the best facilities to these islanders. So I had a mindset at that time, but then that time I was very fresh with no money. Obviously, the dentistry's equipments are very expensive. So then I started a single chair clinic attached with a multi-specialty hospital over there. And in the meantime, I also joined the defense services as an ex-serviceman dental officer. So I had two jobs. Morning I was working there, and then evening I was managing my own clinic. Then slowly, after 1 year, 2 years, I thought that now it's time to bring better things because I was just doing basic dentistry. So I started another setup with 2 chairs, and then I started bringing lasers in dentistry. Then we started calling implantologists. I, being an orthodontist myself, started doing braces and everything in our own clinic. Then again, slowly, when I was into it for 2-3 years more, then I realized this is also smaller for me. So then I, being very much tech savvy, I wanted to go into digital dentistry very soon because that was booming now. So my friend said, let's go to Germany for IDS, and you will get a lot of exposure to what is coming, what is going to come. And then we started, okay, let's plan. We went to Germany, we saw all the latest technologies there. And then my mind was stuck to select machines. But then when we saw everything was good. When I came back, when we went to the company and they said, it's 75 lakhs. And I was like, the chapter was closed then and there. Then we did a lot of courses in dentistry. I keep doing courses. So when I started doing, I was into it too much. So then I started, now I have to get it. I have to see how to get it. So we went out getting, trying for loans and how to get it. So finally everything was done. And in 2018, I started my new setup. And then we bought a CEREC, we bought OPG machine, and then we started new setup with all the latest that was there in 2018. CEREC was very new, it was just 5, 7 or 10 years old that time. And then slowly I kept on doing digital workflows and everything. Then we thought now it's time to get better. So we bought a CPCP. So it's a 3D X-ray that helps us to diagnose implants, root canal, complicated root canals and all. Then after some time, keep doing it, then 3D printed started coming up in the market. So now I was interested in 3D printing. Being, as I said, I like technologies. So then 3D printing was coming up very actively, and most of the thing was done by 3D printer and by digital milling machines. So I put another step forward, I bought a 3D printer also. And then suddenly I came across internet and I saw something AI coming into the market, and I think you were the first person to talk about AI to introduce it to us.
Doctor, can you walk us through your educational journey? Where did you, because in an island like you don't have institutes, so where did you do your undergrad, postgrad? What was the thought process behind it?
So when I did my schooling from postgrad, I went for my BDS to Aurangabad. I did my BDS in GTC Aurangabad for 4 years of course and 1 year of internship. Then I did CA-ship there. Then I got a chance to be a lecturer in a oral and maxillofacial department. But then I had to come back because I belong here. So my parents were here and I had to come for them. So when I came back, I started working as a dental surgeon in the government hospital. GBPAN Hospital was the biggest hospital here in Andamans. But then it was like I always wanted to do more. And here we had less facilities. So then we get transfers. Then I got transferred to Nicobar. I was affected by tsunami. I experienced tsunami. Then in 2007, when we were just having a cup of coffee, and my friend said that, "Do you want to go abroad to study?" I was like, "Where?" And then he was like, "To Georgia." I said, what is this as about? Then we talked about it, and then he said, okay, I can do that. But then I have to arrange funds because my family is dependent on me. So I can just leave them and go. So then we talked about it, everything, and then we arranged funds for my friends. And then I went to do my PG in 2007 to Georgia in orthodontics. Then I completed my post-graduation. I came back in 2010. Again, same thing, started my clinic with my job in the defense establishment. And then I always wanted to do more, to do something new. So I keep doing courses every 6 months, every year. Now, because I'm working in an island, I'm an orthodontist, but then the field here requires all aspects of dentistry. I do more of root canal. So now when my intention is if I do something, I should be perfect. I cannot just do something. So now I started doing courses on root canal. When I go for a course on root canal, they ask, you're an orthodontist, why you want to come for a root canal course? Then I explain them the situation in an island, that is how it works. And then I did courses in root canal, then I did courses for crowns and bridges. And then finally, slowly, when digital dentistry came, then I got exposure to international level. So then I started doing international courses. Like I did a lot of courses by great speakers, Dr. Radoslav and Dr. Gonzalez, and many courses on implantology, soft tissue management, and all those things. Then finally, my friends suggested me that you can even do a university degree from Spain. So finally, in 2020, we ended up doing a specialist course in implantology, advanced implantology in Spain. So that was a university 1-year course. We had sessions in Delhi. It was a very eye-opening how dentistry is growing. It's not just something. Now when patients come and ask, can you move my gums a little higher? I said, yes, we can do. It's just a small surgery. When before somebody used to ask, we were not knowing what it is because it's just because of the exposure. And then when I go and do courses outside, you get exposure with different people around. Everybody's connected on Instagram. Then you see what they are doing. So your education keeps on increasing. So yeah, so this is how still I go every year. I think I do at least 3 courses.
3 courses.
Minimum 3 courses I do every now. Recently I have done a course on FMR because now the peak is full mouth rehabilitations. Patient come with temporomandibular joint pain, sleep apnea, and all those things, but nobody has any answer for those things. They go to ENT, they go to anywhere, they don't have answer because only the dentist who is trained has an answer for TMJ and or sleep apnea.
Correct. Yes.
Orofacial pain is also coming up, but then it's too much, getting into dentistry, and it's very difficult to get a dentist here to practice because I am looking for a dentist who is as dedicated as I am. I don't want just somebody to come and work in my field. I want somebody who is emotionally attached to the field of dentistry. So it is like that. So education wise, I have started from BDS. I don't know how many courses. My staff is all like, sir, aap sara certificate lage jama karte rehte ho, lagaoge kab? So it is like that. All my certificates are lying inside the cupboards. So this is how we went from BDS to never-ending courses.
Interesting, nice. I think, again, coming back to the place, I think it will be very difficult for you to get a dedicated resource, both with respect to dentist or assistant.
Yes.
And retaining them is also a big challenge.
Retaining staff is it's a challenge all over the world now. I think it's everywhere. This is a problem. But fortunately, I am getting some good staff. Staff-wise, I have trained my staff. They are very good. They know almost everything that they have to explain to the patient. Right from basic fillings to advanced surgeries to advanced full mouth rehabilitation. They explain everything to the patient very well. And they assist also. So that is how I have trained them over 6 years. They are with me for 6-7 years. So I have trained them very nicely. Dentists, I am still looking. If anybody is listening to the interview, they are welcome to Andaman Nicobar Islands. We can work together.
Yeah, I live in an island full of peace and work together with this super passionate doctor who has everything in the clinic. So you won't have, there's no dearth of learning and exploring.
Yeah.
Right? It is rather a very unique journey, doctor, because in an island of, I think, 4.5 lakh odd population, and in the city of Jaipur, right?
Yeah.
We only have around 1.5 lakh patients. Yeah. What were your thought processes of investing so much into a CBCT, into a CEREC machine, into a 3D printer, and now scanO Air, right? When we were chatting off camera, you told that your friends were saying that, are you out of your mind to invest, and how you look at the ROI?
Yeah.
What were your thought process of, because you know the upper cap, which usually all the doctors see, is very limited
Yeah.
for this much of a population. What were you exactly thinking before investing?
See, my aim was, I am passionate about dentistry. So I wanted to give the best facilities that are available all over the world. Now, these things are not even available in most of the countries. And I have international clients. So they said they are not even available in their countries, in some places in their countries. So I wanted these facilities to be available to all the people of Andaman Nicobar Island, because this is my island. It was like, I have a feeling. So we should have all the best things that we have for for the people of these islands. So I went into it, and ROI, I never thought initially about ROI or how much I'm earning from it, because it was a passion. So doing some things that you love, you don't think about passion, because whatever I earn, I put in my clinic. I don't put anywhere else. So that is how it goes on.
Correct. See, Doctor, our audience is a mix of practitioners of 0 to 5 years, also 5 to 15 years, and I think few viewers are also above 15 years of practice. Everybody, I believe, would want to know, how did you finance your machineries, right? Because investing in this equipment, it's a lot of investment, right? From 75 lakhs for your CEREC to CBCT of around, I think, 40 lakhs, right? And the bunch of 3D printers that you have. And I had a look at the clinic, and I want to do a video, and it looks so amazing, with everything in a small island like this. How did you finance? Was it through the income that you were generating from the patients? How much of percentage did you have to take a loan? Were these banks or your friends and families that supported you?
So yeah, this is a very big question, because it was very difficult, because I'm also coming from a very small family. Like, we don't have a background of a very rich family. So everything was loan. Because I remember a journey when 2010 I started the clinic. I took 1 lakh rupees from my sister, 1 lakh rupees from my friend, and some 1 lakh rupees from my friends and dealers. And then I started a clinic with 2.5 lakhs. So now, coming to this extent, I took all the resources I had. I took money from the bank. Then I took money from my friends, my family members, everybody helped me out. And so it is like still repayment is going on. It's not easy to pay everything at one go. So we are paying again and again. It keeps coming up. Yeah.
It's a very big risk, right?
Yeah, it's
which
a very big risk.
a lot of people don't take it.
Yes.
Because they first, before investing in anything, a dentist would only calculate about ROI.
Exactly.
Yeah, can I make it? But I think when there's so much of passion and involvement, eventually you figure out things.
Yes.
Right? Yeah. Maybe we can do a deep dive later when we are discussing about how stepwise can you think of when is the right time of investing into all these machines and planning your finances accordingly. But coming back to the people of Andamans, Doctor, since you're from here, right? You've spent your entire life here, right? Barring your education and visits that you do now, what are the main challenges that we have in the patients with respect to awareness of oral health? Is it the same that we face in mainland, or is it, more worse?
Actually, I would say that initially when I started, it was worse, because we were not exposed to the mainland through internet. Internet was poor, but now as Instagram and social media is becoming active, now people are getting aware of the latest in dentistry. So we have clients that mostly go out, either they have stayed out or they have spent like their children are staying out, or they are in the media. They see how we work, what we work in media. So what I would say, I would think that my practice started growing just because of the social media activities. So I would suggest that being a part of social media is very important in today's life. And people are educated. The only problem is dentistry has been neglected not only in India but all over the world. Dentistry is not being a part, except for the Western countries. Dentistry is not considered important. It is just considered as, we have to go to the dentist. So people are now coming up with, I want to get bleaching done, I want to get laminates done, I want to get veneers done. So these are the things that we expect. Now what I am trying is, we are trying to give discounts to kids, children, so that they come and get their treatment done at low cost, so that they can have a good oral hygiene. And what we want to say is that patients should come to us not for dental treatment. They should come to us for smile designing and for complete oral rehabilitations like dentures, implant dentures, like that. Not for root canal treatments and fillings and all. This should be taken care of, because if you get a checkup done every 6 months, everything will be solved.
That's interesting, because we have seen a wave of cosmetic dentistry, right? Thanks to aligner companies or, as you mentioned, social media. Everybody wants a Hollywood smile. But as you rightly mentioned, they also should be looking at holistic care. They need to understand if their mouth is doing good, their body is eventually doing good, and vice versa. And that education, one, is happening through social media, as you mentioned. Did you, in your initial years of practice, did any extra things, for example, awareness camps or any different concept altogether in driving that revolution?
Camps were not very effective, as I have seen, because camps, people look for free treatments. This is not possible because we also have to spend for materials. Dentistry is not like any other profession, like a doctor goes, gives prescriptions and give medicines. It's not like that. Dentistry, we have to spend a lot to, even for a simple filling, we have to have a light cure machine and we have to have a filling, we have a chair. So patients, what they think, it's just a filling. It's not just a filling. You need a lot of things to do that filling.
Correct.
So that is what causes in dentistry, and patients don't understand these things. So we have to make them aware and make them understand about these things.
Doctor, can we cover a few challenges about the place here? It could be logistics or it could be electricity, which can be a very difficult affair in managing the kind of expensive equipments that you have. Just walk us through that and how have you been navigating those challenges?
This is a very interesting question again, because a lot of challenges we face, right from when we have to get an equipment, the equipment has to come all the way, like I have all the imported equipment with me. So it has to come from Germany to Mumbai or Delhi, then from there it has to, the transportation cost for the dealers increase. So that adds on to our cost because we have to pay extra for that. Our transportation cost is always increased, so we don't get the benefits of discounts or offers that are given to other people in India. So this is one problem because everything earlier, then what happens is when the product comes, they have to come again for installation. So that again costs us more time because they send the products, then they come for installations and all. So that again is a challenge. And then we get everything installed, everything is going well. Then we have problems with electricity because electricity is now a problem all over India, I guess. I don't know what other places, but we face a lot of problems because all equipments, I'm the only person handling, and we have all backup generators, inverters, everything in our clinic. But then power failure is so often that it spoils some of our equipment. And being very expensive equipments, we cannot afford service every time. So we have a backup with all online reviews, and all online reviews are again very expensive. So apart from what we have, equipments that we buy expensive, we need some things to back up those equipment. So that again adds to the expenses. And then after investing all these things, when it comes to charging the patients, it's again difficult because as I can say that if I am a clinic that I have invested more than 3 to 4 crores in a practice, the next clinic that comes in line after me must be 40 lakhs or so. There's a huge difference. But then when we charge, we cannot charge according to the patients. Don't understand those things. It's very difficult to charge patients according to my infrastructure. So what I charge is basic. So there is no profit margin too much in my practice because most of the money goes to EMIs and maintenance. And if suppose one part gets spoiled, either that machine is scrapped, like I have an OPG machine scrapped, I have a centering machine scrapped, just because one part is gone and I cannot get it rectified. So those things, it's very difficult to handle. So everything adds on to the cost. So now if they come for servicing, they charge me for flight tickets, stay, plus the equipment. So it becomes very expensive. So these are the challenges that we face, and that we don't have a proper lab in Andamans. The backbone of dentistry, any dentist is a good lab. We don't have a lab setup in Andamans. So what we have is, now we have scanners, everybody has scanners. So we take scan and we send. But what we send outside, what they make, person who is making doesn't see what we need. They are making what they see in the model. Model is not a patient. So that's why so many new things are coming. Extraoral scanners, face scans, and all these things are coming. So the lab is another big challenge that we face in Andamans, because that's why I have bought so much things, so that I can make what I see and what the patient wants. When we give it to lab, it is like the lab guy makes what they need or not what they know, the best what they know. But what we need is, we need according to our patients. It is a requirement for our patients. So that is why these are the things that we face. So everything adds up to our cost of this thing, and managing the cost is very good.
Mm.
So profit margin is not as in other places or as other dentists do, because we use all high standard materials. We don't compromise in the quality of the material they use.
Then what were your drivers in the initial years? For example, from 2010, right, to 2015. How did you get your first set of, say, 50,000 patients?
Okay, see that, I was never concentrating on all these things. I was just working. My passion was, to give good results. And I had a thinking that if you give good results, patients will always come automatically. I was never into advertising. And I had 3 clinics. None of them was inaugurated ever. Okay, I started my clinic I started the clinic, things came and I started working. There was no inauguration or such for any of the clinics because there was no time for inauguration. And just because I had so many, in loans and all these things, money, so I had no holidays. I used to work 7 days a week. Nowadays I'm seeing on social media that you should work 4-5 days a week, get time for this. But then this is people who have already a good background. They come from a good background, they have support. And when you come from scratch, then you have to build that so that your kids, maybe your next generation will come and they will have a better life.
Right.
Yeah, that is like that.
Yes. But are there any regrets? No, right?
No regrets.
What about work-life balance? There's a lot of talking happening around this, especially in corporates. In my opinion, first 10 years, nobody should be thinking about work-life balance because those are the crucial years for building it, right? Post 15-20 years of being in career, that's fine because then you have no responsibility, your family, kids growing up, etc. What message here do you want to say to youngsters, say first generation dentist? I'm sure there will be 2 kinds of first generation, one with a good background, support, and one without. And if they want to start their practices right, we've been lately seeing that first thing that they would see is what kind of remuneration or rewards that we are getting, instead of showing what value can they add to the table. What kind of message would you like to give to those people?
See, in this case, what I would suggest is, instead of coming out of the college and directly starting a practice, you should improvise your skills first. You should get your skills. And nowadays, what is happening is people are just rushing. They do BDS, they come out and they want to do implants. Okay, basic things are out. Nobody wants to do a filling, nobody wants to do RCTs, they just want to do orthodontics or they want to do implants. So they should be, have patience. Because dentistry is something, it takes minimum 5 years to develop, to reach to a stage. So you cannot just rush and never run behind money. You do your work and the money runs behind you. It's like that.
Going back to a point where you never did any kind of advertising or marketing, right? But today, if you look at the Andamans, right? Confidential Dental is one of the brands that we've created. And that came through a good word, right? Word of mouth, through the kind of services that you were giving. And we discussed about the loopholes or the issues that patients earlier had, but now they're educated. What do you think is the future in next 10 years? What things needs to be integrated in your clinical setup as well as done outside on the patient-centric care?
Yeah, so see, this is like, now more of awareness has to be generated amongst the patients. Patients should start thinking not that they have to come only when there is pain. They should have basics like doing school health programs and colleges and everybody. They do programs too. You have to teach the basics, how to brush your teeth, what brushes to be used. These are the very simple things that, people use hard brushes, they use medium, they're not good for them. So we have to do the basic things that has to be taught to the patients. And then we should teach them what basic treatment facilities are available. Because most of the patients, what happens, they go, they have toothache and they get removed to get rid of it. So because they're not aware of what the facilities are, what are the treatment procedures available. So they should, be motivated and they should be taught about all these things. So for this, we need a very big involvement of different organizations that should come together, and we should have camps and orientation programs. For me, camp is not a solution. We should have orientation and educational programs for everybody in the society. Dental oral health programs. Like IDA is doing a lot of programs, but then we have to do at our level also.
What kind of vision do you have with respect to these programs? Oral awareness drives, right? Or oral health drives, where we are educating right from kids or school students to even adults that they need to be looking at all of these. One of the things that we've been extensively doing is through air, through scanO air. is when the patient has the initial level of screening report, which is personalized to his oral cavity, and a set of instructions that he should be doing. He knows what to do. What do you think is the response to your patients to scanO Air when they see this and scan it?
scanO Air is something I liked the basic concept of scanO. Because, like we faced so many problems during COVID because we were the first point of contact to a point that, the COVID spreads through oral cavity and we're the first people who are into the oral cavity. So now scanO Air is something that has given us a solution to get a diagnosis or a procedure that can be done without getting in contact with the patient. So now everybody, we bought this, when I saw the scanO, I bought this scanO for awareness purpose only. My main idea was to give awareness so that we can carry it anywhere, we can place it, we can, let the patient come, explore what it is. People are seeing about AI in all the fields, but AI in dentistry is totally new. Now, because I saw scanO, I have other AI facilities also that are there in dentistry. So AI is something that we expect that it will do a good thing in a diagnostic aspect at least as of now.
Do you see mass change or a big change in the attitude of patient, or is it slowly building up? Because even for patient to accept such kind of a screening report or a procedure, it will take time, right? Because if a machine is telling certain screening report, I'm not sure if 100 people are scanning, all 100 are doing it voluntarily. Sometimes we have to nudge them. So what is your thoughts, and you've been observing it in your clinic?
This is a good question because, it's a mixed sort of reaction from, some are like, oh, it's a machine, how will it give you an exact, but then when they are seeing other patients getting it done and the patient keeps talking, it tells you, and stand here and it calls you by your name. That's something different because everybody is calling by its name. So then it takes the photographs and everything comes very good. So some people don't accept, some people are mesmerized, they want to get it done again and again. And then the basic thing is there are a lot of facilities, I think, I just bought it so I have to explore it a lot. There are some features that the patient can get a review also done when the app is in their mobile. So if suppose he is traveling, he has some problems, or suppose his crown falls off, he just take a picture and send us through scanO that also this is the condition of the tooth, present condition, and you can see. So it is something that is coming up, and I think you are doing good, developing it more.
Yeah. I think this is just the tip of the iceberg.
Yeah.
There are so many things to be developed,
yes.
And especially now with our next focus of soft tissues and AI for radiographs.
Okay.
We are looking at helping our community in reading those radiographs faster, so that we can again focus more on the clinical side of things rather than the administration or these things. Perfect. Coming back to, we've covered the landscape, doctor, and we've covered about the digital dentistry and AI dentistry. We would like to have some fun questions around, a rapid fire.
Okay.
So this will be a very relaxed section, and you can just say out whatever the first thing that comes out of your mind, right? It is like that film. What's your go-to way to relax after a long day at work?
It's family, obviously, because I come back home and we have a movie night with my daughter and wife, and that's all, because we have a very limited circle, and maybe when parents are around, we spend time with family. So family is the way to go of my life after dentistry.
Nice. That one piece of oral health advice you give to every patient.
Visit your dentist every 6 months or minimum every year. Get your oral checkup.
How many of them do what?
That is hardly 10%.
10%?
It's very poor. It's hardly 10%. But then we keep motivating. I think scanO is good. We keep. There's a facility in scanO, I think, that you can show the future of the. So that is a very good part that I like, that you can show the patient that this can lead to this.
Correct.
So even if they don't come for a review, and if it happens that this led to this, then next time they will obviously come to us that we were not saying something to earn money, we were saying something for their benefit.
Yeah. As you mentioned, right, 4 crores of investment of your clinic versus the second in line is 30-40 lakhs. So they can have higher margins. You can't.
They almost charge the same.
You can't charge patient say 4x or 5x,
Yeah,
which is your investment.
Yeah,
But is this challenge because of patients who don't have capital to invest, or it's a mindset?
no, it's a mindset. it's a mindset like it is a procedure. He also does the same. He also do the same. Why is it expensive? They're not. Some people even some patients even say that it doesn't matter what you have. I want this thing. I want an RCT that guy does for this much. You do for so much. That is what is my concern. See, even I have clients from abroad. Like I have patients from Sweden, Italy. They are very happy when they get their treatment get done. I have patients who have been advised implants there. They came, I did their re-RCT, I gave them a crown in a day. Like they come in the morning, next day they have go to kneel, they come from kneel, they get their crowns done and next day they go. So if they love this facility because these things are not available in their place and if it is available, they are sky high. So that facility that they get, they enjoy there. So most of what my mindset is now we have flights from Malaysia and we are having foreign tourists. So that may boost my practice and I will get some benefit out of that.
Correct. Yes.
My way to go is I'm looking for a clientele that understands my value.
Correct.
And my practice value. That's what I would say.
Right. Yes. I think that's a common complaint in patients in India, whether it's mainland or an island, right?
Yeah.
Where the mindset is a problem. Capital, they have enough which they spend somewhere else also.
They go out and do it. Yes, of course. Many people, they go out and they get full mouth implants and then they come here and then the screw loosens. And then they have to go back again to that person because every implant has a specific driver. So they face the problem. When they face the problem, then they realize. Because we try to give everything and we even, for our implant patient, we give them 1 year warranty. We do everything for free for 1 year. Anything. If there is a screw loosening, if there is a small problem, we do it free for 1 year. That is what benefit that we give if they get it done from us. Because we have all the record, digital, once I scan, everything is with me.
Correct.
Next time they come, I just have to remove the old crown and just fix the new one. So I have the crown ready for them.
Correct. Right.
That is the benefit.
You mentioned about a lot of international clientele coming in, right? Because the airport is now international.
Yeah.
What kind of extra efforts are you taking or you think of investing in driving this dental tourism? Because whatever patients that you get so far, how much is it? Like 10% of total patient visit which is international?
Not 10. It is just starting. It is just starting. Few of them, 2 or 3, but then they are referring me. Like last time one patient came, she got us through Google and the best part was, she said, I see everybody 5 stars and you are only 4.8. So I was interested in your practice. So she took an appointment there from there itself. Yeah, she went through my Google. She said, I saw your whole profile. She saw my reviews. Said you have a lot of 1 stars. So and then that's how people come to know about the practice because you have to be active in like advertising is not important, but you should have a website and you have a Google handle and everything to get into. So international clients are increasing, but then let's see. We are hoping for the best. We are trying to get something sorted out for that. To catch that client.
Right. I think one of the good solutions is also to have satellite centers, say in Myanmar or Indonesia or from wherever we have these international patients flying in, where they can get their initial level of screening and they exactly know what is wrong, have a tentative treatment plan while they are there. So when they come here, they have an estimated timeline as well as the cost of, and of course the value which was going to be provided.
I think now that's why AI will help. Your scanO will be all over India, and then we can link. You can, I think, find something, a way to link all the dentists around, so that patients can even, suppose they're getting consulted somewhere and they want to get a referral somewhere else, they can do through scanO and this. It's a good source of AI.
I had one question when you mentioned, right, we faced big tsunami in 2004.
Yeah.
And that is when you had opened the clinic, but you were working from 2000 at the government hospital. How was the situation of people? Were they, we know the total number of damages that had happened. But with respect to oral care, was it even more neglected? Or what was the pattern from 2004 to 6?
See, the oral care, those days were very much fixed because I was a dental surgeon in Ireland. Okay, it was like I escaped the tsunami just by 20 minutes because I left the place where 100 people died. I just came back from that place, and when we were there in the islands, a lot of people had toothaches and dental problems, but then there was no electricity because of tsunami. Everything was shut down, everything was cut off, and people used to come to us for toothaches. We could not do anything. And that is an island that is, you can either travel by a boat or by a chopper. So the boat takes at least 1.5 days, chopper takes, but it is like one chopper carries only 4 people. So it was very difficult for handling dental problems in Nicobar especially.
Correct.
And other places also, people were totally confused because tsunami was something that has taken back Andamans, I think 10, 15 years back, because everything was damaged outside. So it was very difficult for patients also because most of them were financially affected. So dental treatment, I think, would have been a second choice because I was in the government, so I have no idea about the condition those times. But then there was a lot of setback for many people.
And was there any jugaad that we could do because there is no electricity, right? All we can do is hand materials.
We used to use a torch.
Put temps or something.
That's what we were doing. We had the chisel and
acute pain.
Yeah, we used to use the old-fashioned chisel. I had the chisel from my school and college, so I used to use that for some management. Extractions we used to do in a very crude way, but then that was the only way a patient could get relief of. Patient wanted the tooth out, so we had to do the assistant holding the torchlight, and I had moving the tooth with chisels and elevators. Nothing to do because we did not have burrs to cut the tooth and remove the tooth. So it was very difficult.
And sterilization was
traditional. Sterilization was done. Is there because that is the basic thing that is very, very important. Sterilization is a totally different aspect in dentistry. Still, many clinics don't use a Class B autoclave. It's very, it's a very big topic to be talked about. So, what we used to do is just put everything, put spirit and burn it off. That's all. So that is the best part of sterilization. I think many senior practitioners would know about this procedure. What we do is we put take a tray, put spirit in it, and we just put fire on it. So by the time the spirit burns off, everything is sterile. All the bacteria is gone. So because spirit is 100% alcohol, and then the fire is the temperature. It's an autoclave in itself.
Interesting. Those days, right? They were very difficult for us to relate.
Yes.
Thanks for sharing that journey. I have one more question for you, Doctor. It's a very interesting one, and I'm sure as much as you would enjoy, our audience would enjoy as well. If you had the power to bring one major change or improvement to oral healthcare in Port Blair, whatever change, right? What would that be?
That's for that, I have a dream. Yes, for that. I don't have a space. I was planning to set up a very big dental setup with like 10-15 chairs, and so that we can cater to all the categories of it. We can have the treatment that would cost them, like extraction 500 rupees or filling 1000 rupees. We will have a setup like that for people who cannot afford expensive, and then we would have an elite practice that would take care of people who want high-end things. So that was what I am planning, because I cannot say that no, we would do treatment charges less, or we would do this, we will get discounts. It's not possible because you have to categorize the treatment.
Correct.
Like you will use a average material, and then but then they are all standard because nothing in the market is without FDA approval. Everything is approved by FDA. It's just that the quality changes and the company changes. So we can have all the range of materials, and we can cater, and we can have dentists who are interested in learning. So we can give them opportunity to practice also. So so we can cater to all the walks and all the population of the people who can get treated under one roof. It will be confidential multi-speciality center, and then we will provide facilities to all the people of the areas.
Wow. So
that is one thing that I am planning, but I don't know when it will come through, because Andaman, again, land is very expensive. To get a land in Andaman is a gold mine. So if I get a land, of course, that is my way to go in near future, maybe 5-10 years.
But can we take support from the government for such a project which will benefit the population, right, in the end?
Government has projects, but then we need to have a land. Government has a lot of projects, but then we need to have a land. We will work on it, because this is a thing that came to my mind last 2-3 years ago. So just because I'm too occupied with my practice, I don't get time out of my practice. The only thing I am out of my practice is when I go for courses. That's the time I'm always in the clinic. As I said, I don't have holidays.
Yes.
So that we will plan, and we'll do something good for these islanders. It is my island. I'm a son of the soil, so I would, of course, do the best for them.
Right.
Yeah.
Your favorite thing about living in Port Blair?
Oh wow. My favorite thing about living in, it's a very peaceful place. I love the peace here. I have visited so many places all over the world. best part is we don't have to travel a lot in Andamans. And the weather is so good. And then it's all nature. Wherever you go out, it's nature. Seas, beaches, and sand and everything. So it's the nature that I like.
And you envision yourself staying here for the
Yeah,
rest of your life?
for the rest of life. Yeah, most probably.
AI in oral health, is it a game changer or just a hype?
It's a game changer. It's truly, it's just, I think it's just a starting. Just like you said, the tip of the iceberg. Many things are going to come up, and AI is going to take over the dental field. Not that they are going to take over the dental practice or dentist practice, but then they are going to help them to get more accurate results. Like, dentistry is always looking for accuracy and perfection. So now AI is going to help us to achieve those goals. It's not going to take our jobs, but it is going to help us to go to reach that perfection that we want to have in our practice.
So you believe that this technology is here to stay?
Yes, obviously.
Okay, this is interesting. If you weren't in oral healthcare, what career would you be in?
Oh wow! See, I was very much interested in flying. It would be funny, but I was very much interested in flying aircrafts. I always had a desire to be, a pilot of a fighter jet aircraft. Yeah. So I had the thrill in my life when I was a kid. So if I would not, maybe I would have gone in some defense establishment or a defense setup, something like that, something related to Air Force. So I like that. I had even tried to go for Naval Academy and all when I was a kid. But I think it is fortunate because now I'm doing very good in dentistry. So that would have been my next if I would have anything to do.
Wow, interesting. That's very interesting. But I think flying an aircraft, you can still do it, right?
Yeah. Now
the commercial side
yes,
for passion.
But I think flying an aircraft and flying a jet aircraft is different.
Different, yes.
Maybe someday I'll be sitting in a jet aircraft.
Then that day we'll be doing sequel too.
Yeah.
It's too much of passion and dedication that we see here. It's very rare. We don't see in all of our professionals or all of our dental surgeons.
It's a pleasure.
And as much as I have enjoyed the conversation and got so many insights about oral healthcare, how is it to be living in an island, to be servicing people in a remote island, I'm sure you also would have enjoyed. And if you have any questions, please feel free to drop in the comment boxes. We would love to answer them all. Maybe make some short videos also for our audience to be answering those questions. We've talked so much about the past, about the present, but let's dive a little bit into the future. Doctor, if we have to envision your practice 10 years or 20 years hence, what would we see?
So see, as I see now, we have bought in scanO, the first AI diagnostic tool, and I have just done courses the Digital Dental Forum. So I have seen robotics and dentistry. Now robotics are coming to dentistry. Now it is like when we place an implant or when we do a root canal treatment, we do it something, it's a blind procedure. So when robotics has come now, we can see where our implants are going, how my root canal is being done. I can see it live on the camera, on the TV. So now our next is something, like we have a lot of robotics coming up in dentistry, like Yomi and Navident, semi-robotics are there in India already. So now we are looking forward to get a setup that has all those advanced things in these areas. I think there are only 20 or 30 machines in India of semi-robotics, digital navigation systems in India. And I think Yomi fully robotic has not yet entered Indian market because it's way expensive for Indian market. So the future would be, as I said, big hospital, all the facilities, and then we will have the top-notch facilities in that place. We already have everything. We just are waiting for the robotics to come in the market. So maybe in the next few years, we will have robotics in Andaman Nicobar Islands also.
Wow, that's a future to be proud of, and that's a future that all of us should be envisioning for our practices to serve our population better and to level up the game of dentistry. To an international standard. I remember one of my speeches that I had given during my internship when we were just, graduating is till when will we be following ADA procedures, ADA, the guidelines by ADA, or all these technologies coming from out? When will we see the day when we are making these technologies in-house, made in Bharat, made in India for the world. And now I think the time has come, right? We are seeing semi-robotics already happening in India. We are seeing AI, first of its kind, diagnostic tools like scanO already happening in India and serving the world. We can't wait for the day where we will be seeing fully robotics happening in India. That, of course, would be much cost-effective for Indian population, for our practitioners, and inculcating those kind of guidelines in India for the world, right? And I think that day is not far where we would be making the guidelines and classification for the world. Yeah?
That should be the way.
Yes. Thank you so much, Doctor. It was awesome talking to you.
It was nice
really
talking to you.
appreciate.
So,
Yes.
yeah.
I hope all of you enjoyed as much as we did, and see you in the next episode. Please like, share, and subscribe to us, and keep commenting on what all you want to listen to or hear about next. Thank you.